This is Dr. Mark from Leader Orthodontics. Today I'm going to talk about another case of phase 1 evaluation. The good treatment starts with a good evaluation. So in this case, which I'm going to be showing you here, patient is actually a cousin of one of my assistants. When he came in for a consult with a big open bite, and the patient is about 8.5, and this open bite was happening because of tongue thrusts, and I think there was a history, a little bit of pacifiers, but it's mostly tongue thrust, which a lot of the time means narrow arch, narrow palate, mouth breather, tongue thrusting forward, and the real cause is why the tongue is doing it. The patient wants to breathe. Now, when we treat airway issues or open bite issues, it's like the chicken and egg. Is it the tongue cause the open bite, or is the open bite make the tongue goes forward? Now, regardless who's the reason, now they both problems are there and you need to treat them. You need to close the bite and you need to restrain the tongue. Now, you cannot restrain the tongue without the bite being closed. You cannot close the bite and leave the tongue to reopen it. That's the notion that a lot of people get confused about. So here is going to be showing you the progress, which I can go through, and it will show you after months of starting the habit appliance, which has a little bit of cage so the tongue does not go forward. Look what happened. The teeth start erupting and coming and closing. That's the nature, the bone, the softness that's happening at this age that you need to resolve early. A lot of the time I see orthodontists, when they don't know what to do, they'll tell the patients, wait and see. In some cases, wait and see is not great. So wait and see could be great for some treatments in medicine, but there are problems in medicine that we cannot see and just wait on them, like tumors. So this is a case like similar. When you want to fix it better, you want to work with their bones, and I'm going to show you even more progress just so you can figure out the closure that's happening. At some point we put a braces on and we just make sure it's all fully closed, because remember, I want to close the bite to start working on the tongue. And as you can see, it gets even more closed. You have an overjet, which is amazing. We did some expansion at phase 1. Today he showed up years later evaluating for phase 2 and if he needs it. Even though we did expansion at phase 1, a lot of the time I end up still needing more expansion at phase 2. We don't charge extra for expansion at phase 2. In this way, it's coming really out of the care for the patient, nothing with financial drive. So as you can see, the kid now, this is the very important part, that old, like geriatric smile with no upper display compared to showing all the top teeth. That vertical development of the bone around this area, that is a lot more important than just teeth to be biting together. That is why phase 1 treatments, evaluation, cases like those and other cases, is a key to be done by airway-driven orthodontist, a phase 1 driven orthodontist to develop orthopedically on top of just the teeth. Now, we're ready to start the phase 2. Looking forward to make his life and youth looking amazing, and that's what we want. We want this child to be a very attractive, functional, breathing well teenager. Thank you.